For a Parkinson patient, living with the hallucination can feel like battling illusion daily. But what if I tell you that there is a way to fight back with this troubling symptom? Hello everyone, my name is Dr. Puru Dhawan and today we are going to discuss some highly effective approaches to manage hallucination in Parkinson patients. But first, let's talk about what are exactly hallucinations. So, this is a situation when a person sees, hear, or feel things that are not really there. But all this can be scary and confusing to the patient. But what can be the reason for this? This happens because in Parkinson patient, a sharp decline in the observed in dopamine secretion. This further results in improper functioning of the brain in both physical and chemical ways. I hope this much is clear to you. Let's now understand what are the simple steps that can help reduce hallucination in the Parkinson patient. To understand the steps, firstly you need to do one thing. And what is that? The surroundings. Yes, it might sound strange, but the surrounding of a Parkinson patient can greatly affect how they see and understand things. Now let's discuss the steps that can reduce hallucinations and make life easier for the patient. First is the type of light in the room of the patient. Let's first talk about the dim yellow light, which is usually produced by the bedside lamps or the lantern in the room. Such lighting creates deep shadows that can disturb the way the patient sees things. So I advise all my Parkinson individuals to avoid such kind of environment. Next comes the white bluish light. The light is better than the yellow light as the shadow formation is not very much. But still there are little chances of hallucination. So what is the solution for this? That is daylight. Yes, natural daylight is the perfect because it is neither too yellow nor too blue and it creates a balanced and soothing environment, providing a relief for the patient. I hope this is clear to you. Now moving on the next factor, what is the other thing in a room that can be changed to make the patient environment better? Think and tell me. The color of the walls. Imagine two colors. One is painted in a dark shade like this and other is painted in light shade white. Out of these, which room seems more brighter and larger to you? The room having light shade like white or off-white. Now understand the concept. The dark color walls tends to absorb light and create shadow and make the room look smaller, which tends to uneasiness for the patient. On the other hand, light colored walls look more spacious and bright, helping the patient to feel calm and relaxed. So if possible, choose soothing and light colors of the wall. Now let's move to the next factor and that are the curtains in the room. Usually every room in our home has curtains. Now imagine a scene when the fan is switched on, curtains are like moving and the patient is alone in the room. Don't you think that such a situation will create a sensation of someone else in the room? Yes, the movement of the curtains may cause fear and panic in the patient. So the easy way to solve this issue is to replace light weighted curtain with the heavier stationary one and stay in the place even when the fan is on. I hope these three elements are clear to you. By making these small adjustments in the surrounding, a calmer and safer environment can be created. Along with all this, some extra thing can be done like avoiding mirrors in the room. Reflection in the mirror can sometimes confuse patients, making them think the reflection is of someone else. If removing mirror is not possible, ensure they are covered when they are not in use. The room's layout is also very important. Too many objects can create confusing shadows, keeping the space tidy or reduce confusion and make the area feel safer. So this was all in today's video. I hope you have understood the steps clearly. While medical support is crucial, these home changes are also crucial to enhance the patient quality of life. Living with the Parkinson's can be tough, but we are here to support you every step of the way. See you in the next video with more such helpful content for you all. Till then, take care, bye-bye and namaste.